Okay, so Dr. Riccobeni, you're going to explain exactly how you're putting these on now, and it's a pretty amazing process.
Right. Well, I think the whole case from start to finish has been pretty amazing in what we were trying to accomplish. One of the biggest thing we were trying to accomplish, because you speak every day, because you're used to where your tooth position is, and just in speaking that we didn't want to change or create a lisp or change the way you speak. We really had the challenge of keeping the length of your teeth and actually the distance between your lower teeth and upper teeth exactly the same. So one of the things that we couldn't do with your teeth was to lengthen them. So on the cast, there's a marking here of where the length of your teeth was to start with. The other challenge we had, ideally we had talked about doing Invisalign or doing braces to get your teeth sort of in line before we did the shells. But again, due to your job and your daily activities, you wearing even Invisalign trays and speaking on the radio would have been definitely a challenge for you. So what we opted for doing was, putting veneers on your teeth, reducing the areas where we could, as much as we could without compromising, ultimate health of your teeth. And try to create a smile that, although we know because we weren't able to do braces, it may not be the textbook model smile, but obviously a major, major improvement from where you were. So these are your teeth when we started. So our challenge was here, especially this canine that was sticking out. We needed to bring this canine back in, at least in line to where the other teeth were. And then you had some spacing in between your teeth, and obviously the overall wear of your teeth due to your bite. So those were the challenges and the things that we were trying to accomplish, in addition to changing the color of your teeth. Okay, so this is the model of the teeth after we prepared them for the veneers. And if you can tell the difference, there's about 0.5 millimeters on most of these teeth that we took away just to make space for the porcelain. Now you need a minimum thickness of 0.5 millimeters in order to match the underlying color of the teeth, and also to give the technician the ability to add enough porcelain to these teeth to give them the kind of shape that you're looking for. Mm-hmm. Now on the canine that was sort of out there, we did have to take away a little bit more, about 1.5 millimeters, and that was the most we could take away because we didn't want to encroach on your nerve and then have the potential of you needing a root canal or anything like that. Okay?
Right, we don't want that.
Right. So these are the veneers, and as you can tell, they're thin little porcelain shells. They're almost just like a contact lens, except for the tooth. Huh. Okay. Now the thickness is 0.5 millimeter. You can see how thin they are. Now they have curve to them, so the thickness is uniform throughout, but that can really show you the thickness of where you are there, about 0.5 millimeters. So when you have a tooth, you prepare it, and then you place this shell on top of it. You can go from a tooth that looks like this to one that has a little bit better shape.
Right.
Okay, and also most importantly has a better color as well.
Mm-hmm.
And when you look at the length of the teeth, again, we were trying not to compromise or to encroach on the length of your teeth because we didn't want to change your speech. When we look at these teeth in relation to the starting cast on the bottom, we can tell that the line of where your original teeth were is right in line with these teeth. So we did not in any way lengthen your teeth. Okay?
Right.
The only thing you might feel is that they might feel a little bit thicker on the front because we did add 0.5 millimeters. Now we took away 0.5 millimeters, but still the fact that they are uniform now, whereas before they were a little bit flatter, they might feel a little bit thicker, but ultimately that's the kind of feeling that will go away within a day or two. And I think the improved aesthetics and just your willingness to smile will far outweigh that possible feeling of them being a little bit thick.
Right.
All right, so now we'll get you to sleep.
Now, that is another big challenge with me because I am not a patient who can sit here in the dental office, probably because of some past trauma I had. So you have to actually sedate me every time.
Right.
Although one time you did a little something and I was able to bear it because you were so gentle and I had headphones that were really loud. But
Well, that's definitely one of the challenges that we have, as dentists. Every patient is different. I mean, it's one of the challenges, but it's also one of the things that makes our job very interesting. We have different patients with different needs, different desires, and different past experiences, and every patient has different goals. And what we try to do is to work with people to help them accomplish their goals and treat them in a manner that they want to be treated. And some people, due to past experiences, need to be sedated. And obviously that's what we've had to do with you on a number of occasions. But ultimately, if it helps you get the work done and you're happier with your smile and it helps you smile more and just project the kind of image that you want to, that's enough for us.
well, it's great for me. I'm excited.